I hadn't realized till you just said it.
Yep, yeah, here we go. Well, Dr. Peter Lombard, who is a regular here on the link, crunching COVID statistics, it has been a wild doc, which I felt like it was a good thing. I mean, don't take it personal, but I was like, I haven't seen Dr. Lombard in a while. Well, that's good because we usually only ask him on when there's a lot of COVID data to crunch, and there hasn't really been a lot of it. Well, there is now, though, as we kind of end week 2 of what Dr. Hoa Wen is calling a Delta surge, Dr. Lombard. And just kind of talking offline here, what does the data say? Or when we were talking offline here, you seem to depart a little bit from what Dr. Hoa was saying, right? And I guess we'll just start there.
Well, not necessarily. I certainly agree with the sentiment that this Delta variant is extremely worrisome. It has been, I don't know, it feels like it's been 3 or 4 months since the last time I was on. And I just realized it's been like over a year since I used to do those Facebook posts. And that was a real scary time for us. And I think that the main theme I want to come back to, today is just for us to remind ourselves how lucky we are to be here in Guam, where we have 63% of the total population around there vaccinated, fully vaccinated, and certainly well over 80% of the adult population vaccinated, because that is absolutely saving us right now. I mean, can you imagine how many hospitalizations and how many deaths we'd have if we had, say, half of the current vaccination rate? It would be at levels that probably dwarfed what we saw at our worst times last summer. What it would have triggered would have been massive lockdown. And so the only reason we're not sitting there right now and having to make those decisions is because we're fortunate. We have been able to get a very high number of people vaccinated. When you compare our vaccination rates to the rest of the U.S., we're sitting there close to the top. And I think it's very instructive to look at the other states that are doing about as well. New Hampshire, Maine, Pennsylvania, and what do their cases look like? Absolutely, they're spiking too. And I think anybody that's been following the news in Delta knows that the mainland U.S. is sort of preceding Guam in terms of the Delta wave. And while you're seeing the increase in cases, the positive news for these places that are well vaccinated is that the death rate is significantly decreased because we have vaccinated a lot of people that are elderly and with comorbidities, and the ones that are getting hospitalized, even though the hospitalization numbers are going up, they're younger, fitter population. And we're also not necessarily seeing in these states their resources being overwhelmed. And at what point do we call that in Guam and say, okay, our medical resource, and that's critical. And I think that's going to drive the severity of the response from the governor, for example. If we're at 10 to 15 hospitalizations, how comfortable are we, seeing that rise to 20 to 25? I feel like that was the same discussion we did have a year ago, is how comfortable are we with that number going up? Do you remember what our max number of hospitalizations were last year?
I think it was like 70 something, right?
I think we're over 100.
Over 100, okay, right.
Yeah, and our ICU.
I kind of blocked it out, Doc.
Yeah. For good reason. It was a scary time, and the hospital was absolutely overwhelmed, and you didn't want to have to go to the ICU. And you're seeing that in places like Louisiana, Florida, Georgia, Atlanta right now. And it's directly because that they don't have enough people vaccinated. The vaccine has protected us from this Delta wave being much more of a nuisance than it already is becoming. That's not to say, things may still continue to get worse. And I think that the school issue is a big one. And, one of the worrisome things that I've seen in the last day or two is that while the mRNA vaccines, Pfizer and Moderna, they are doing a great job of protecting against severe illness and deaths, the transmissibility still seems to be fairly high, even with vaccination. So, it's tough, the messaging that gets out there. I can understand the need to get the vaccine message out to say this is going to protect you, but it can be misconstrued, and then people feel like it's a little cynical to say, well, you said the vaccine was going to save us, and it's not black and white. It's not this dichotomy of vaccine is the end all be all. I mean, I think most people realize that.
Not really.
I'd like to think that most people recognize that, at least, that we are entering a phase of the pandemic. Worldwide, we're only vaccinated like 15% of the population. So we're still globally, we're still sort of early in this, and these pockets of COVID infection are going to persist everywhere. And with travel, with even locally, you're going to have pockets of COVID. And so we're entering this phase here where even if we're 70-80% population vaccinated, we're still going to have low levels of people with disease. And what does the return to normal mean? It kind of means, what are we willing to accept? Can we start to treat this like any other respiratory virus, like influenza, like RSV? And that depends on what's still the threat. How much morbidity are we seeing, and how it checks our hospital resources? So, I think the next, obviously, I don't have a crystal ball. I think the next 2 weeks are going to be very instructive, especially, I don't know how much the schools are going to affect us. I think it would be a little silly to think that the schools opening up aren't going to impact our numbers, because you've got a lot of kids in close proximity, and we don't know how much the 3-foot rule and the masking is going to make a difference. I think that one of the things that we're probably seeing, people that are vaccinated, probably a lot more of them have actually been exposed and infected, but they're just asymptomatic. So I have a feeling that our actual case numbers are quite a bit higher than what we're actually seeing. I think we're only catching the people that are symptomatic. Again, kind of a similar theme to the kind of thing that we were saying last year.
Right.
But I'm not super concerned just yet. For me, like even last year, I felt like, okay, you start getting the hospitalizations into the 20s and 30s, 3 to 4 people in the ICU, then you start, okay, when is it too late to lock things down? That's a tough question, and it depends on how quickly the rate is changing. And you take a place like Florida again. You say, when should they have acted? Obviously they don't have the type of metal, if you want to call it. The population isn't really committed to NPIs at all. The governor obviously is certainly actively trying to block any efforts to try to influence more NPIs there. So we're lucky to be in a place where I think a large percentage of the population, despite what you see on social media, I think a large percent of the population is on board with trying to keep everybody safe.
Right, Doc. I mean, it just kind of seems, after the lull we had and the high number of positives, and when you hear about the contact tracing, now they're still kind of wading through that, and then you also hear that the PAG is anticipating a couple weeks more of these high numbers. What would you say to those in the community who feel like we're teetering on the edge? I mean, even with the vaccinated population, we do see sometimes those breakthrough cases. I know someone who's vaccinated who's pretty sick too. So what would you say to those people who are kind of thinking that we're in the middle of this surge and we need to do something yesterday?
Well, I think it's still, again, look to the other places that are a little bit ahead of us in the curve, and they haven't reached that tipping point where things have gotten crazy out of control. And if we follow suit because we are at a similar level of vaccination, not to say we shouldn't be a little worried, and not to say we need to take personal responsibility, but I don't think it's time for mass panic and alarm bells to be ringing for us to go into a severe lockdown again. We're entering this phase of the pandemic where we're just going to have to figure out at what level of infection and hospitalizations are we willing to live with while still trying to maintain some semblance of normality, or what we're used to anyways.
Right. It definitely seems, in talking to Dr. Wen and the PAG, that they're not going to recommend a full-on stay-home lockdown, right? What I'm hearing is that they're going to present the governor with a few different sets of options to maybe include something with occupancy, but relative to the number of customers who are vaccinated. We're tracking a lot of different things, Doc. But if you were in the driver's seat, what recommendations about restrictions would you make? Do you think that we need to dial anything back in a little bit? And if so, what would be probably maybe a couple of the most effective things we could do to slow the spread?
Well, I think some of the things that are on the table sound great. They're not that severe. I think people are already used to some of these milder interventions, and so tailoring those interventions towards vaccination status, I think, is very reasonable. I think some people will get hot and bothered by that, but I think there's a lot of good reasons, good scientific reasons to make decisions that are based on vaccination status. I don't say that lightly either. I mean, I'm a big proponent of a liberty and having the right to do what you want to, and to I really struggle with the question of making vaccines mandatory. But I think that it's hard for me to understand somebody's decision not to vaccinate. I had a patient yesterday in his 70s who hadn't been vaccinated yet, and he didn't have a great reason. And after we talked about it, he actually said, "Okay, doc, that sounds good. I think I'll go get vaccinated next week." So I'm like, yes, I think there's still people out there that are vaccine hesitant, but not necessarily anti-vax, where there's no way, And
Right.
I think that that education and that outreach needs to continue, and we need to take the opportunities as providers to just continue to ask our patients what questions they might have about this, because the data is pretty clear to me. I mean, I think one of the other concerns is, we see the Delta variant and the havoc that it's wreaking, but again, with only 15% of global population vaccinated, we're going to see more variants, and some of those might turn out to be variants that are more virulent. And so there was just data came out this week that showed places with higher vaccination rates had lower mutational frequencies of the vaccine, of the virus. And that just makes sense. In order for the virus to mutate, it has to be replicating. And it's only replicating if it's in a host. So the more people in an area that have the virus, the more chances of replication. And these replications these mutations are mostly random, but sometimes those random mutations will confer some sort of increase in virility. And so the more we can suppress the virus with vaccination or by any means, the more we can suppress the virus, the less chance to get those future mutations. But we're going to see them. And I think that, I'm reaching for reasons and ways that we can further educate people that are still hesitant to get the vaccine. I mean, from a safety standpoint, I can understand people are still a little bit unsure about the safety, but it's really hard to understand that too when you've had hundreds of millions of people, I don't know, maybe even a billion by now, that have had the vaccine at this point. And we can tell you with pretty high certainty, this is a safe vaccine. We're not seeing any significant worries and side effects, and the benefits are just. I don't know how you could not see how the benefits don't outweigh these extremely small risks from the vaccine.
I think where it gets muddy for so many people is that they are just of the mindset that a vaccine should prevent you from getting sick. And I think that's, if you just look at the comments on any story about COVID, it's always about how many currently with COVID are vaccinated or not vaccinated. Like, I don't even think that matters, because the accepted science is that even if you're vaccinated, you can still get the virus, you can still give it, you can still get sick. The main point of the vaccine is to stave off serious illness and hospitalization.
And I agree, and I think I think some of the people that are saying that are saying it just to be cynical. I don't know. I think they actually realize that, but I think they're just trying to prove their point.
You're right, Doc, because I see some of these people in the comments and they're just hating on the vaccine, but then they're vaccinated. So it's like, okay.
Yeah.
But
how different is it from the flu vaccine? I think everybody already accepts that. They understand you can still get the flu even though you get vaccinated with the flu vaccine. Yeah. The flu vaccine is mandated in schools and in various workplaces. So, there's some discrepancy there in the arguments, I think.
Yeah. What did you make, though, of there's an article, I'm pretty sure you saw it, FDA might recommend a third shot for the elderly or the immunocompromised. And we've had this booster shot conversation on this show before, and it wasn't just with the elderly and the immunocompromised. Dr. Hoa Wen just said that he anticipates everyone having to get a third shot sometime down the road.
Yeah, that'll be interesting to see how quickly they roll that out. I'd be surprised if it happened this year, but I think more likely we're going to see FDA approval for full FDA approval for the vaccine, and also children before we see the booster for the general population, but I may be wrong there. I think it's a good idea. I mean, again, you're looking at maybe 50 to 60% transmission benefit from the. It wanes to that level after 6 to 12 months with the Delta variant. It's so from that perspective, Delta is the primary concern out there. Then I think doing getting a booster shot that helps to increase the control of the spread, and that's what the booster would do. It would help to prevent as many people that have been this large group of vaccinated people from transmitting the virus to other people, even if they don't get that sick themselves. So I can see that becoming a reality, and I wouldn't have a problem, putting my hand up for the booster when it is offered.
That's a good talk, Doc, and it kind of just seems like, from what we learned last year in the pandemic, that it's a race against time in many ways. Like, how do we time getting the elderly, the immunocompromised, a third shot, while the Delta variant's raging? How do we time restrictions when we're in the middle of a 2-week surge? So can't even wrap my mind around it, Doc. I wasn't ready for this.
Well, again, I think, the positive news out of other places as well is that the case fatality rate, how many people die out of X number of cases, where last year we were seeing 1 to 2 people out of every 100 that would pass away that were diagnosed with COVID. And now we're seeing that number decrease to maybe 1 to 2 out of 1,000. So, we still may have some deaths, and I think it'd be foolish to think that we won't. It'll just be somebody that's unfortunately unvaccinated, most likely, somebody that's elderly, that for whatever reason. I had I had a friend of mine from my residency program, same age, and he a physician and ophthalmologist, and he chose not to be vaccinated, and he unfortunately passed away 2 weeks ago. And it's really hard for me to understand somebody very smart to not want to take the vaccine, and he left behind a family, and he left behind a career, and there's so much more good that he could have done in this world. And it is hard, and I think we're certainly not completely out of the woods, but I feel pretty confident and comfortable with the numbers that we're seeing elsewhere, that things aren't going to be too terrible at this point.
Doc, thanks for your time this morning.
Thanks for having me.
Right on. Be safe.
All right, you too.
Wash your hands. Dr. Peter Lombard. It's 8:02. We did have a bunch of comments here that we'll get to after we jump on to KUAM TV again. This is the link, proudly brought